Hi, everybody. I'm Allison with ACR Health, and I'm very excited today to have a special guest, Dr. Marylene Duah from Samaritan Health in Watertown. Dr. Duah is an infectious disease physician that has partnered with ACR Health for many, many years and is supporting our first Frost event coming up on Sunday, October 25th. Thank you, Dr. Duah, so much for being with me today and for sharing a little bit of what you do with us. I appreciate it.
Thank you for having me.
Can you just share how you were introduced to ACR Health?
Well, it goes back to 22 years ago, I would say, 1997. I think it was December, and I think two of your case managers showed up in my office, and they wanted to see who this new infectious disease doctor was in St. Lawrence County. And I'm like, oh, two old men. They were kind of older. That was back in the days. And they, I guess I got the sign of approval as soon as they met me. And they said, well, we're moving all our patients that are going to Vermont and to upstate to see you. So instead of traveling to those areas, they started coming to Governor. That was back in 97. And I moved to Samaritan in 2005. And all the patients for sure continued with me. I have about 125 patients now. And I've been with the agency since then. I haven't done the walk when I was in Governor, but I did it for the past 15 years with my kids. I have been to every one of them, and my husband and a bunch of friends. And so that's how I started with ACR Health. So it's been great. I mean, it moved from AIDS to all chronic illnesses. So changed a little bit its face, but they're still there for us.
For sure, for sure. And so you mentioned that was 15 years that you've been with First Frost. And can you just share why it's important to include your family and the community in events like this?
Well, you know, I mean, there's a lot of messages that ACR gives other than just supporting our HIV. I mean, I started it thinking it was for my patients and their families to show that I care about them in my office, in the hospital, plus in the community. But then I realized there was a bigger message to it, you know, between teaching sexually transmitted diseases to kids in the schools and then PrEP awareness. And I mean, the PrEP message is still not enough there, you know, out there. So I hope we do get that message. And that was one of my most important messages, because I think HIV/AIDS is now a chronic illness. Just like, honestly, I tell my patients it's better than diabetes. You don't have to change your diet. You can do everything you want. You're going to be alive and well, and you probably have a life expectancy better than a diabetic. So, but avoiding those infections is even more important at this point. So, so it's very important for young kids and teenagers to get that message.
And you've seen so much change, I'm sure, over the past 20 years. And now with COVID, how is COVID affecting your patients in your area?
I've only had one patient who had COVID. She is a nurse, an LPN, and she did fine. She just had a little cough and stayed home just for her 2 weeks and did perfectly fine. Nobody else had it. So for the most part, I mean, most of my patients have been safe, but as you know, the number of cases have been low in Jefferson County, so we haven't had much of a problem. But based on the research, you don't see that HIV patients, or based on different places in Europe, HIV patients haven't done any differently than non-HIV patients.
Good. So there's some good news there at least. Any advice or any guidance that you want to give us all in, you know, not only in the COVID world, but when it comes to infectious diseases? You spoke about awareness, but anything else you want us to know about what you're doing there at Samaritan, things to be aware of, ways to be educated?
Well, in terms of COVID, I know we all get tired of, you know, masks and And I can hear my friends saying, is it that really important to mask? And, we're all getting tired of putting our masks, but definitely that has shown through the years, even through the flu, and, that definitely decreased the risk of infection. And no matter what people are saying, that we still need to mask and still avoid parties. We're all getting tired of not meeting up, but we just got, some exposures in our hospital off a party that happened on the weekend. And if we want to keep our numbers like this and we want to decrease the number of people dying, we got to keep doing what we're doing, because New York State has done well. But strict hand washing and masks are imperative. At this point, we need to continue doing the work. We can't afford any more deaths. It's been too many.
Yes, yes, yes. I thank you so much, Dr. Duah, for all of your support of our agency, of our community, of First Frost. We look forward to seeing you all. Please join Dr. Duah and myself on Sunday, October 25th at 1 o'clock. You can register by going to acrhealth.org/events. And you can also learn more about PrEP and some of the community programs that Dr. Duah mentioned also on acrhealth.org. Thank you so much for your time, everyone. Thank you, Dr. Duah, again, and be well.
Thank you.